right to give me the credit for being one of the first, because I think there are a lot of people doing research within the field of especially adolescent psychology that built a framework about adolescent development that is applicable within a youth justice environment. But I do feel proud that I and a few other people helped carry that message across from the purely academic studies of adolescent development into the world of practice and policy in a justice environment. And of course, youth development had already been established in the fields of youth services, family supports, but the questions about how to do that in a youth justice system are difficult, and they still apply. If we can go on to the slides. I don't think it's controversial anymore to say that positive youth development, positive adolescent development is public safety. I think it's important not to simply characterize this as a service initiative. It's public safety to have youth, as it says here, youth with good pro-social assets, who know how to avoid risky drug behaviors, who know how to avoid conflict, who are tied to their families, who know the skills and the experience of engaging in positive experiences. You cannot do that in a single agency. You cannot do it with a single provider, and certainly not a single therapist. You need to connect young people to all the stuff that people from wealthy communities basically take for granted, listed there in blue. Good relationships. I always say that crime would go down if every adolescent every day heard someone say to them, "Wow, how did you learn that? That's amazing. How did you do that?" If they all had that experience on a regular basis, they would start to feel the self-efficacy that a person needs, especially a young person, to navigate their way through life. Skill development, success in learning, not necessarily school, but success in skill development and having something that you've learned that other people value. And then also the normal stuff, physical activities and sports and the arts and being connected to your community, political involvement. I think we've seen big increases in young people being politically engaged, and I think in the long run that will turn out to be very positive for the country. Move on. One challenge is that there is no shortage of frameworks, and these frameworks have all been around at least 10 years. There are more around. There have been many people who've tried to characterize the basic principles of adolescent development and turn it into a field that can help young people navigate the world around them. And next slide, I also am guilty of helping to perpetuate even more frames. The reason we put out this report 10 years ago was because there was a large number of frameworks that spoke to the fields of adolescent psychology and services in general. But we tried to write this in a way that would help people see a direct application to the field of youth justice, which is complicated. Next slide. Complications are somehow you have to persuade lawmakers who are used to responding to youth justice as part of their crime agenda that all the things I just described about being adolescent development are public safety. If a state legislator, a county commissioner, an elected official is used to responding to the pressures of crime policy by offering more and more punitive approaches or social control, and then they hear someone say, well, how about a nice arts program and an after-school sports thing? It could take some persuasion. We also get caught up in thinking that the youth justice field should be mainly about coercing young people and families into complying with our orders, that you will go to these appointments, you will comply with this drug test on a regular basis. But complying with orders and routines does not develop someone's capability to have a life. So all those things should be seen within the perspective of the broader goal, which is about, as it says there, transforming youth justice to facilitate youth development. And that means principally attaching young people, helping them feel attached to things that are positive in their lives, social assets and activities and skills and relationships. And then the next challenge, the one I focus on, I started off in services. I was a social worker for a while, but the last 30 years I've been full-time research. And It is a big challenge to establish these ideas from a research perspective. And I would tell you, I've been doing research a long time. I've done this with a lot of clients and a lot of partners. And I would say there's two kinds of amateurism in the field of research. One kind of amateur you encounter is the doctrinaire, rigid professor who refuses to talk about anything that's not a random assignment study and dismisses anything that sounds squishy and imprecise. And those are the people that are always trying to persuade lawmakers that if something's not evidence-based, you shouldn't do it. And I'll tell you later what evidence-based means. The other kind of amateur in the field of research is the researcher who will do anything necessary to hold on to that contract and that client, and who will promise you the world and create a report that may look like a research report, but it's full of holes and thin, and it's just not strong. And it leaves, if you're the agency who's commissioned research on one of your programs and you work with one of these people I just described as an amateur, it opens you up to being vulnerable to criticism, because there are plenty of people who are smart enough to go through that report and say, well, this is not good, this is not rigorous, that you didn't prove anything here, and you want to avoid that. So those two kinds of, you need to try to live in that sweet spot of a partner, someone who is good enough and skilled enough to know what you need, and not only thinking about what they need. So academics only think about, and I know I'm an academic, but academics tend to only think about journals, peer-reviewed studies, and what's going to get me promoted. You want a trained academic who understands all the intricacies of research, who cares about your mission, your problems, your challenges, and tries to bring their skill set to helping your agency meet its goals. And that's a challenge, because obviously we all live in a world where we have to perform in order to be paid, in order to be promoted, and academics are not often encouraged to do this kind of work. So when you find a researcher like that, hold on to them, make them a partner, establish relationships. That's really what you need. Okay, so let's talk about what I mean by good research. It says pre-post here, but this graph so far just gives you the post. Would it be evidence that you could use for a state legislator to say, we opened up our program, we have a new style of probation, or we're doing this drug treatment program or this family therapy program, and after young people finish that program, we measure their failures on probation, their compliance with conditions, or their rearrests, their recidivism. If you offer that kind of evidence, it will often work in a media setting, a political environment. You can say that during a legislative hearing. We opened up our new probation program and recidivism is down by 20%. And people will accept it, but that's not evidence. And you will be vulnerable to having that argument undermined by someone who can see that it's not evidence. So you have to be careful about how to proceed with that. Moving on, a stronger design is to do a true pre-post where you collect baseline measures. Let's say it's an intensive supervision program or a family support program. You don't just have young people come into the program and then see how they do afterwards. You collect data about how they were doing before. And this could be something simple. You could do a questionnaire. Youth assets, you could ask them what they do during the day, what are their activities, how many friends they have, when's the last time they went to an organized sports event. Ask them about grades, school attendance, and then you have them go through the program and you ask them the exact same questions in the exact same way at some point after the program. But you have to do a couple things. The little gears that are moving imply that it's not okay just to say, we have a program and these are the young people coming out of the program. That's not strong evidence. You need to collect data about each young person's experience in the program. If it's a group therapy program, how many sessions did they attend? Did they stay the whole time? Did they speak up? You need to have inputs. You need what we call measuring inputs, like what did they actually do to get engaged in that program. And then you need, the little clock there implies you need to control for the time at which they left the program and how long the follow-up period was. If you just say recidivism was 42%. That doesn't mean anything unless you qualify it by saying how long you collected the information for, and did everyone coming out of the program have the same period of exposure. If you have some kids that finished the program 2 weeks ago and some that finished 6 months ago, and you just add their numbers up, that's not research, that's sloppy, and you need to avoid that. Moving on. The basic problem here, though, is this implies some kind of causal chain. It implies that when you collect baseline data, then you watch them in the program, you collect that data, and you collect outcome measures. You're basically implying that the program produced the outcomes. And a pre-post evaluation cannot do that. Now, I've done pre-post evaluations. All researchers do them because you can't always have the resources you need to do something stronger. But this is not enough to prove the efficacy of an approach. It may be enough to get the attention of your state lawmakers to get you through the next budget hearing, but you need something stronger than that. And the field needs something stronger than that to begin to treat youth development and positive youth justice as a real intervention that produces public safety. And I use that word produce because you have to show that your program created an increase in public safety. It's not just you're serving people, you're actually making the community safer by supporting young people. So how do we do that? Moving on. That means you have to have, and I'm sure you've all heard your research partners talk about this, you have to have a comparison group. You have to have some way of saying, were it not for the program, this would have been the outcome. So that means, and you collect your baseline measures, and then some young people go through the program and some young people do not. And you try to collect data about both. You have things that happen during the program, but you also, if someone's in the comparison group, you need to know, did they somehow get assigned to that new church group and get engaged in something? You don't want to treat them as a tabula rasa comparison set if it turns out they're also involved in lots of stuff. So you have to measure that as well, the researchers do. And then you measure outcomes, and that allows you to say, these kids who came through this program have these outcomes, and similar kids in the same situation who did not get the program have these kind of outcomes. And if you find a difference, now you're on your way to having evidence to start to show that you actually produced youth development and you produced public safety. One more grievous error people make, and yet people do it all the time because it sometimes works, is to say, young people came through our program and they have a recidivism rate of 42% compared to the usual recidivism rate of young people, especially coming out of our facilities, who have a recidivism rate of 80%. The media will print that or publish it. Lawmakers will believe it, and it's total horse pucky. I guess I can say that. If the same kids need to be exposed to the different treatments. You cannot compare a population who's come through a probation program with a population of young people who were confined or incarcerated for a time and then look at their recidivism rates. It's totally misleading, but I know that people do it because they get away with it so often. My concern is this field needs, and our communities need, to start showing that positive adolescent development is public safety, that if you do these things right, it can actually help young people, help families, make communities safer, and make the crime concerns go down so that lawmakers can think about something else. If we don't do this, we're going to be stuck with all the things that are already established, which are fine. Individualized family therapy, drug treatment, fine. But that is not going to solve the crime problem or the community safety problem, because, and there's a lot of misinformation about this too. That's one necessary thing you have to do to deal with mental health issues and drug abuse, but it's not the solution to youth crime, because most kids involved in youth crime do not have those issues. If you wait to measure them until they're locked up, yeah, then most of them are going to show mental health problems and drug abuse problems, but that doesn't mean that's what got them there. And that's a tricky thing that people forget all the time. Okay, moving on. This quasi-experimental design, though, is still not rock solid, because you don't really know that the comparison group is just like the treatment group. And that's why, and if any of you have worked with professors and academics, you've heard this: randomized designs, experimental designs. Next slide. And That is when you have control over who goes into the program and who doesn't. And it's randomized. It's a roll of the dice. It's a flip of the coin in terms of whether you hit the program or not. Now, this has a lot of challenges to it, and it often is impossible to do. I've been a researcher for 30 years, and I've been involved in exactly one experimental program of intensive probation in Detroit, Wayne County. And that was only possible because the state was facing budget pressures, and they informed all the counties in the state that they had to reduce their bed count by 40%. So Detroit came to us as researchers and said, we have to cut. What do we do? And so we convinced them to segment the population into young people you definitely did not want to expose to the community yet, young people you definitely wanted out of your facilities, and then a third group where you could see it going either way. And we said, as long as that third group is there where you could see it going either way and it's not a threat to public safety and it's not unethical, let us randomly choose which ones go into probation and which ones go to state commitment. And that was a strong design because it truly was randomized. And the results showed basically that confinement doesn't provide any stronger long-term outcomes than a well-run youth program. So that was an exciting study, but it's rare to be able to do a good experimental design on this kind of system. When we see experimental designs in youth justice, it often means they're therapeutic programs because you're randomizing individual people who volunteer to be exposed to randomization. And that's an important part of youth justice, but it's not a solution to our challenge here because there's no one intervention called youth development. A good youth development program uses sports and mental health agencies and human services and schools and lots of things. And to have a randomized procedure where some people get all of them and some people get none of them is a real challenge. So we can't answer all the questions at one time. Moving on. Keeping in mind that any research design has to focus on several levels of measurement. And if you work with a research partner, you'll hear these words. And I'll tell you, it says here what they mean. So inputs are the basic building blocks. What happens? What do young people do? What do families do? What activities are there? What's the day-to-day reality? Outputs are the outcome. The outputs are the results of those inputs. So it's not just we have a program that does this. It's this young person, this individual youth went to 3 sessions or went through this training session and finished and got a certificate at the end. You have some way of saying this was done, this was completed. And then outcomes are the behaviors and accomplishments at the end, not just negative. That's a big problem in this field is people think as long as we measure failure, we're in good shape. So we'll measure rearrest, reconfinement, drug failures, dirty urines, and we're good. That's not the pathway to building youth development as a key partner in youth justice. You have to measure the good things you're trying to accomplish, not just the bad things you're trying to avoid. Next slide. And the complication is the whole, as you all know, I'm sure, the world is very complicated. All these things on the left side are things that could create risk and lead to greater public safety challenges. All the things on the right side are things that should help young people avoid criminal behavior. And you cannot do a program to address all these, and you cannot do a study to do all these. Next slide. So what we need are approaches that build evidence that are suitable for all young people, not just focus on mental health and substance abuse, that help them develop resilience and not just things that we want to change. So not just recidivism, but help them build strength. Focus on protective factors and healthy development, not just risk mitigation, and that are suitable where you can collect all that data I just described, inputs, outputs, and outcomes. If you just do some of them, you're not going to develop strong evidence. Next slide. So what we need to get to the point where people do talk about youth development as an evidence-based practice, an evidence-based program. And there's no one study that will do this. We can't all wait for Larry Steinberg in Philadelphia to write a journal article showing, oh, this is it, it's evidence-based. That's not going to happen because it's so complicated and there's so many tools in the toolkit. We need to do a study of each one, but we need high quality studies of each one so that a researcher proves definitively with a rigorous design that participation in this after-school arts program where young people make their own music mixes actually did change behavior and actually meant that young people in that program were more likely to go back to school to graduate. Those are the kind of things we need to do, and you can't do them all at the same time. So we really need a system of studies, an agenda, and we can only do that if researchers work in partnership with you. So I hope you are aware of this, and I hope you're looking for good partners in your own communities that can help you do this work. And that is the end. I appreciate the time, and I look forward to the discussion.